So before we get started, I'd like to first introduce our three esteemed panelists. So first, we have Joyce Burrell Garcia, Special Projects Manager in Metro System Security and Law Enforcement Department, where she leads the agency's efforts to address homelessness. So welcome, Joyce. Thanks for being here today. Next, we have Steve Fiechter. He's past Senior Director of Metro's program, where he oversees the outreach, interim housing, and supportive service programs in metropolitan Los Angeles. So welcome to you, Steve. And last but not least, we have Karen Barnes, who is past Associative Director of Multi-Disciplinary Teams for LA Metro. Karen leads the coordination of PATH's outreach teams, consisting of diverse specialists working in the field, directly connecting unhoused riders with supportive services. So thank you, Karen, and thank you to all three of you for joining us today. So why don't we start out with a question for Joyce? So homelessness is not new here in LA County. So when exactly did Metro recognize that this was a big issue on our system? And when did the agency start to work to address this challenge?
Thank you. Thank you so much, excuse me, for the introduction, Julia. And Metro actually began to recognize that homelessness was an issue in 2016. It was at the direction of our CEO that Metro created a homeless task force to address homelessness in and around the transit system and align action with county and city of Los Angeles priorities. It was in February 2017 that the Homeless Action Plan was actually finalized. The plan focuses on maintaining a safe and clean environment for our patrons while connecting homeless persons in the transit system to services and resources under measures H and HHH. Also, under the action plan, Metro hired 2 homeless multidisciplinary outreach teams to engage with homeless persons and connect them to services. The pilot has shown, it did show prodigious results. It was very, very successful, with approximately 12% of those contacted receiving permanent housing solutions. As of June 2018, Metro expanded this pilot program to 8 multidisciplinary teams, day and evening throughout the entire system. Sort of fast forwarding, we are now in COVID season. And I would like to let you know that as of April 2020, System Security under the Chief of System Security and Law Enforcement, we launched a very ambitious outreach program. It's called Operation Shelter the Unsheltered. This is a collaborative outreach operation between our PATH outreach teams and our law enforcement partners. The Operation Shelter the Unsheltered provides, first and foremost, a heightened presence of outreach teams and law enforcement partners at end-of-the-line stations. Also, under this Shelter the Unsheltered, we are able to close Union Station nightly between the hours of 12 a.m. and 5 a.m. to clean and sanitize trains. Also, another part of the operation is our offloading strategy. We offload all riders at the end of the lines. All riders must exit through the turnstiles and re-tap to re-enter the station, the train platform. Also, which is very, very important, is that our outreach teams are positioned at turnstiles to offer resources, water and snacks to persons who appear homeless. This operation continues to be successful. The total number of individuals housed between April 2020 and to date is 610. So we are very, very pleased with the outreach efforts and the collaboration that we have with our partners. I do also want to bring up that in October, System Security and Law Enforcement launched a very innovative homeless 4-day homeless count on rail and on bus. What we found during the 4-day count on rail was that the average homeless count was 1,143 individuals. That's a lot of homeless individuals on the system. We also did a homeless count on the bus system. And we found that the average number of homeless individuals that were present over a 4-day period was something like, the number was 9,726. So Metro remains poised to continue to move forward with our outreach, to utilize the resources that we have available through our PATH outreach teams, as well as our law enforcement teams. We are continuing to expand. We are continuing to look at other options. And so this is where we currently are in terms of addressing homelessness on our system.
Wow, well, thank you, Joyce. And we're definitely keeping you busy, and it sounds like you and your team are doing some great work out there. Now,
Thank
I would
you.
like to, you're welcome. I would like to check in with Steve. Steve, welcome. It would be great if you could tell us a little bit more about PATH. How long has the organization been around? If you can describe the work that you do, as well as when you started your partnership with Metro.
Absolutely, a pleasure to be here today, and thank you so much for welcoming us and for this amazing partnership. PATH has, for the better part of 4 decades, been reaching out to our neighbors experiencing homelessness, meeting the needs and challenges of those folks on the streets, with services and support, and connecting them to the resources that are available to move them from that experience of homelessness into permanent housing. So we began here in Los Angeles, and our roots are very deep here, but we've expanded to provide these services across the state of California now, from San Diego to San Jose. From boots on the ground, team outreach to the folks on the streets, in interim housing, and also in the development and support of folks living in permanent supportive housing as well. So we are a broad-based and very active organization across the state. We're extra delighted to be a part of this partnership, and thankful for the coordination and cooperation that we have with our Metro partners. That began around about 4 years ago with the pilot that Joyce mentioned on one of the lines, and has expanded since that time to provide the multidisciplinary outreach focus that we provide across the system, to reach out to those experiencing homelessness who may be on the trains and buses or in platforms and in bus stations across metropolitan Los Angeles. So we're happy to be here, and I know that there's lots of details that folks may be interested in. I know that Karen is here as well to provide some of that insight. Thank you.
Thanks, Steve, and we're happy to have you on the team helping us to address this important issue. Now I'd like to move on to Karen. So you manage the multidisciplinary teams that engage with our unhoused riders. Can you tell us a bit more about how these multidisciplinary teams work? How do those team members work together to get this job done?
Sure, thank you so much for having us. So currently we now have teams on both our swing shift, which is a 3 a.m. to 11:30 a.m. shift, as well as a day shift, which is a 7 a.m. to 3:30 p.m. shift. Each of those shifts we have specialists. So we have outreach specialists, who are people with significant experience working with this population. We have mental health specialists, who are people who are therapists or masters of social work. We have substance abuse specialists, who are certified substance abuse counselors. In addition to that, we also have nurses. We have RMs, as well as a physician assistant. So the teams work together to provide services from a different backgrounds of knowledge, different knowledge bases, but basically all team members do the same thing, which is to go out and to build rapport with our people, get them connected to services, and eventually move them into housing. Our nurses are also able to provide things like wound care, medical assessments, some medications, COVID testing, flu shots, things like that, to bring medical care to the people who are living in the system and are not able to access it more easily.
Okay, thank you. That's great info. I'm going to pivot back to Steve for a moment. Steve, you manage many of PATH's teams, and you have this unique view of homelessness overall, both at a regional level as well as from your on-the-ground perspective. What is something about this regional challenge or about unhoused individuals that people tend to miss or they tend to misunderstand?
Yeah, thank you for the question. I think there are general assumptions that people make when they encounter people who may appear a certain way, whether that be disheveled or in a state that we might automatically label as someone experiencing homelessness or even someone who may be dangerous. So many of our neighbors who are experiencing homelessness also have mental health challenges. They've experienced a great deal of trauma in the experience of homelessness, or a great deal of trauma that's brought them to the experience of homelessness. So I think for us, one of the things we like to remember when we're reaching out is that each person has a story, and they arrived at this point in a unique way, and that there's going to be unique challenges and unique opportunities for them to move beyond to safer and healthier environments. I also think that that some of the broader assumptions that people make about people, for example, who may have mental health challenges, are that they're dangerous, perhaps. But the statistics actually bear out that those who are experiencing homelessness and those who have mental health challenges are far more likely to be the victims of crimes in the community than they are the perpetrators. So we keep that in mind as we go out, recognizing that sometimes there are definitely challenges in the way people are behaving or appear, but we also lead with heart and compassion to reach out and build rapport with folks to get them to a place where there will be cared for if needed, and also be able to care for themselves if they're so empowered.
Thank you. So now I have a question that I would like each of you to answer. We'll start with Joyce. So what are some of the biggest challenges that you face when you are doing this type of work, and how has your work been impacted by COVID-19? Joyce, you're currently muted.
Thank you, Julia, for the very complex question, because even pre-COVID, the issue has always been a shortage of shelter beds. That has been exacerbated by the pandemic. And we find that because the shelters have been reduced, their capacity has been reduced because of distancing. We are now in a position where we have less options in terms of where we can actually house people. We also have challenges with the time of day that our teams deploy, say at 3 a.m. in the morning. Social services, they have business hours. So there's nothing that really can be done with individuals early in the morning, except for to provide nurturance and reassurance and get information, so that by the time shelters do open, that we're able to at least take a look at what is available. I think we're also looking at the winter months coming. And so there have been historically shelters that open in November, I'm sorry, which they will open this November as well. I think the 26th of November, select shelters will open. And so we will be looking at more people that will need to be housed during these colder months. So shelter is a profound issue for being able to really direct and place our homeless population into services so that they feel comfortable and they're willing to move forward.
Wow, that's a great answer. Steve?
Yeah, thank you. I certainly underscore everything that Joyce has said, and in particular in those shelter environments, that we're mindful that that's a space where people can begin to heal from the trauma of homelessness and get reconnected to society in meaningful ways and to the support and services that they need, whether that be medical, mental health, substance abuse, or whatever that may be. I think in the age of COVID, all of our lives are topsy-turvy, and that folks experiencing homelessness, their lives were already upside down, but flip it again, because now there's this to be concerned about. We're very careful to address our services in the framework of any advice or directives that come from the health leadership, the Health Services Department, which oversees our contract here in Los Angeles County, and the Centers for Disease Control that send out regular information about what it looks like to stay safe not only for ourselves, but also for the ridership and also for the people on the ridership experiencing homelessness, that we want to make sure folks are socially distant and have the appropriate protections so that we can minimize any transmission of the virus and keep our entire community safe.
Oh, thank you. Karen, we'd love to hear your thoughts.
Sure. So in general, challenges regarding outreach. So typically the way that outreach works outside of the metro is that you're going to encampments, you are meeting with people, you're meeting the same people again day after day. You have a lot of time to build rapport and get to know people and to establish trust, which is so important in this type of work. On the metro, our folks are mobile, so they're constantly in motion. We meet them, that might be the only time that we ever meet them. We need to immediately build that rapport, immediately find a way to engage them. So our team is much more fast-paced than a general outreach team. In terms of COVID itself, that's also made some difficulty with building rapport. We're wearing masks, so we're not quite as friendly looking and as available as we normally would be. The type of things that we would normally do with people to engage them are, let's go sit down in a restaurant and have something to eat. Let's take you to the DMV right now and get you an ID. Let's take you to a medical clinic. A lot of those things are not open right now, or there's a long waiting period, or we need appointments. So that's made a lot of things, more difficult in terms of accessing services. And also, as both Steve and Joyce mentioned, the limited amount of resources in terms of things like shelter beds has also been a challenge.
Wow. No, thank you. So I will point this question. I'll start back with Joyce. What should people do if they see a person on the metro system who's experiencing homelessness, or if they see that they're confronted by someone who might be experiencing homelessness? What should they do?
What we advise individuals to do is to be very careful about assessing what's really going on, first and foremost, because homelessness is not a crime. And so many individuals that we see on a daily basis on the system, they may not present a threat to us, but in the event that someone feels as though the individual needs to have immediate assistance, we recommend that you use our transit watch app to report an incident. You're able to describe what's going on, the type of assistance that you need. Also, you can call or you can text the information. So utilizing our Transit Watch app is a real resource to download if you already haven't. If you in your communities, when you identify people that you certainly know they need help right away, there are several things that you can do. We recommend that you use la-hop.org. That is the Los Angeles County's portal where you're able to report where an outreach team is needed, where perhaps law enforcement is needed, and where perhaps 911 is needed. It's certainly, if you find that there is a crisis, it's always best to call 911 first, and everything else will be taken care of. But these are some resources that we advise you to take advantage of, because we have a lot of individuals that are in need of help. And so many times we can't help everyone, but for those that are calling out for help, we can see that they are in distress. We ask that you use these resources to report the incident.
Thank you. And Karen or Steve, would you like to touch on that as well, about what people should do if they see someone on the metro system who's experiencing homelessness or perhaps is confronting someone?
I'm going to let Karen answer that.
Sure. I think one thing that we just want to make sure that everyone understands is that using something like LA-HOP or contacting outreach services is not a crisis response. So, sometimes we will get calls where it's something like, someone was seen at a station on Tuesday. They're probably not still going to be there. If you are comfortable approaching someone, getting their phone number, we can reach out to them. LA-HOP's a situation like that is something where you see the same person in the same place day after day, so they can deploy a team. And if it's an actual emergency, if someone looks like they need immediate medical care or something like that, then we do ask that you call 911.
Okay, thank you. So now I have another question that I would like each of you to touch on. So the work that all of you do is difficult and can be somewhat draining at times. What motivated you to pursue this career, to work in this field, and what keeps you going? Let's start off with Joyce.
Thank you. Working with working with homeless individuals is something that I've never had this much experience before working with directly with homeless individuals. I feel very fortunate to be working with a team like Path that provides the direct service to those that are in need. But my experience with homelessness has it's been broad. In my church family, we have homeless outreach missions. Generally, it's always about being able to help those that are in need. So through my church, through my background growing up, seeing people that we call them at the time hobos, but we would see hobos, and I remember many times my grandparents would prepare a lunch and give the lunch to the homeless or the hobo, and so that was the beginning of my appreciation for being sensitive and always wanting to be helpful to those that are in need. So my position here at Metro is being able to manage the homeless outreach component of all of what we do. It's very, very special because Metro has made a commitment that I'm so very proud of to be a part of, to be able to address not only the homeless on our system, but to be a part of the larger system, the larger solution within the county of Los Angeles. So that's been my experience. Thank you for asking, Julia.
Oh, thank you.
Mhm.
Steve?
Thank you. I really consider this the issue of our time, and the work that we are doing, all of us in this partnership, a real calling to recognize how marginalized folks are, to recognize the challenges that we all face when we encounter our neighbors, the feelings we have about that, and how we kind of have to reach out then beyond those feelings to connect with people. And I really feel like this is the very tip of the arrow in terms of humanity moving into the future, and expressing compassion and cooperation and those
Yeah,
values that I know we all cherish. So
right.
I'm so thankful for everybody, the support we have, the challenges we face, and the folks who are willing to raise their voices to point out those challenges and help in any way they can. Thanks.
No, that's great. Thank you. Karen, we'd love to get your perspective.
Thank you, Julia. Yeah, so I started out doing this kind of work when I was 17 years old, volunteering, doing street outreach in Skid Row in Hollywood. And during that time, I got to know a lot of the people on the street and hear their stories. And it's always struck me that we have people in our society that are out on the street that are just now sort of invisible. Maybe they used to have, a life like all the rest of us, and now they don't anymore. And we don't know quite why that happened in their particular lives. But as you get to know them as individual people, you realize that these people deserve to be seen and be heard and deserve everything that the rest of us have. I think, especially with the pandemic now, that's probably made it very clear to a lot of people that we are all just a paycheck or two away from homelessness ourselves. So it's really important that we're able to appreciate our neighbors who are experiencing homelessness and view them as part of our population.
Thank you. Wonderful answers from all of you. So my last question, and I'm going to aim this one at Steve and Karen. So we are approaching the holiday season. As everyone knows, Thanksgiving is next week, so yay for that, right around the corner. So are there any donation drives that PATH has going on that the public can contribute to, or if they feel called to do more to try to alleviate this issue, what can they do? Where should they go?
Thank you so much. I have to admit, I get really excited when I see turkeys on sale at the local market. But then my heart goes out to those folks who have no space or place to prepare something like that, or or even think about where that might come from. So in terms of the generosity of those folks who may be listening and want to become involved, our website, www.epath.org, epath.org, is a great place to start, to check into how you could possibly assist with donations and other support, financial as well. During the time of COVID, during the pandemic, there are some challenges in terms of food preparation and things that we're able to receive and then distribute. Used clothing at this time is not something we're able to use, but certainly new things, and particularly for people experiencing homelessness, items like socks, hygiene items, and things like that are always welcome all year round. And we know this is the beginning of the season of generosity, but we hope that can last throughout the year. And I'll pass it off to Karen too, because I know the boots on the ground folks who are literally out there every day doing this work have a keener insight into the types of things that might be needed.
Our team, we really appreciate things that are small. We are walking and riding the train. So we are not generally driving around in a van like typical outreach teams. So things like small snacks, hygiene kits, socks, things like that, water bottles, those are great things for our team.
Thank you. Well, I want to thank all of you. Thank you, Joyce, Steve, and Karen, for this wonderful conversation on such a difficult topic. I'm now going to throw this back over to my colleague, Christina, who will begin our question and answer session with our audience.
Thanks, Julia, and thank you to all the panelists. That was a really informative discussion for such a serious topic. So I really appreciate all the work that you all do and your teams do every day in the office or in the field. So we do have a lot of questions, as you can imagine. This is a high interest topic. So, and I do see we have at least one hand raised. So just a reminder for everyone, in case you joined late, to join the speaker queue. If you wish to ask something verbally, you can click the raise your hand button. If you're joining by the phone, which I see some people are, press *9. You'll be added to the speaker queue. And then when you hear your phone number called, press *6 to unmute yourself. But otherwise, add your questions in the Q&A, as I see a lot of you have. So let's get into it. Okay, we have someone anonymous who asked, how has COVID affected getting people into housing? Has social distancing been an issue? And I imagine any three of our panelists could answer that.
Yes, social distancing has been an issue, particularly since the onset of COVID-19, and it continues to be an issue. And it's going to be a heightened issue, as I said earlier, once we move into colder weather, because the shelter spaces that are available, the emergency shelter spaces, they will have to adhere to the distancing protocols. And so that simply means that throughout the city and county, there will be less shelter spaces available, but we're working together with the county and the city and other social service agencies and other nonprofit organizations to speak about what can we do, what recommendations do we have to be able to address the challenge that's before us. So Steve, Karen?
If I could hop on there really quickly too, in terms of permanent housing, and Karen had mentioned earlier, there's some glitches in how we can provide the support based on COVID social distancing requirements and certain agencies that may have restricted hours or have created new policies. Despite all of that, I'm going to lift up this team and offer kudos for the fact that we continue to move people into permanent housing. I know to the layperson's ears, those numbers may not seem huge, but a single person moving from homelessness over decades through a complex system to get support and services they need into permanent housing is a really big deal, and it's happening daily. So thank you to the team for that. It's how it all starts. We open the doors and we continue to push. The challenges in our community, as everyone in LA knows, are the the rental level, how much it costs to rent a home, and the cost of housing and the supply continues to be prohibitive. But the team continues to use those creative tools they have to find ways to make that happen. That doesn't mean we don't need to keep pushing for more, but I do really want to emphasize that it is happening.
Great, thank you. All right, I'm going to actually take a question from one of the folks raising their hands. Dominique or Dominic, I'm gonna unmute you right now. Feel free to unmute yourself.
Okay, thank you. I've been a writer on Metro and on its predecessor agency for most of my life, for several decades. And historically, I've been sympathetic towards homeless writers who've been seeking shelter in the Metro system and towards homeless people in general. However, with the current COVID-19 disease pandemic, those homeless people who are not wearing a face mask are threatening safety towards other passengers, towards Metro employees, and towards the general community. I think that Metro should do more toward to enforce making everybody use face masks. I'm not African American or Latino, but I understand from the news media that those communities have two objectives which are conflicting with each other. On the one hand, some people in those communities do not want more police enforcement. They feel unsafe because George Floyd died and because LAPD Metro officers have been caught lying on their body cameras. So they don't want the police or the security to enforce passengers wearing masks. On the other hand, the African American community and the Latino community are suffering disproportionately from COVID-19. So if any passenger gets on a bus or train or a subway station without a face mask, they're threatening everybody, including both people, regardless of what community you live in or what your racial background is. So I think that Metro should be enforcing more face masks. Metro employees, if necessary, police, security. At about 11 a.m. this morning, I took a trip on Metro and I changed from one subway line to another subway line at the Roche, Vermont subway station. There were several people there not wearing face masks. Some of them appeared to be homeless. There were two private security officers in light blue uniforms that walked right past them and did not ask them to wear a face mask. So you've been doing, so I think that homeless people or anybody else that uses Metro should be required to use a face mask. I'm happy that PATH is able to help a few homeless people get supportive services and permanent housing, but that doesn't address most of the problem.
Yeah, thank you, Dominic.
Yes, yes. Dominic, good afternoon, and thank you so very much for your question and your concerns. I think what you're saying is what a lot of people are saying on the system. People want to know, a lot of our writers want to know, why isn't everyone wearing a mask? Why doesn't Metro do something to enforce and force people to wear masks? And the reality is that because homelessness is not a crime, and because we don't have the legal authority to force anyone to wear a mask, our position is we try to educate people about wearing a masks. We offer people masks, but we cannot force them to wear a mask. We don't know, there's some individuals that have health challenges that do not allow them to wear a mask. Perhaps they have a respiratory issue and they're not wearing a mask. But for those that are choosing not to wear a mask, we we're doing our very, very best through the use of ambassadors, through our law enforcement teams that have trained personnel to address individuals that don't seem to be compliant. We try to ask them, we try to educate them, and we offer them masks as well. But we can't go beyond that boundary, because then we are moving into an arena that is fraught with legal issues, and that's not where we want to take Metro. Steve, Karen, do you have anything that you'd like to say on that? As you engage individuals in your work that are not wearing a mask?
Our team does distribute masks to individuals who we are working with, and we do request that they put one on. Obviously, we can't force them to. But in general, people have been pretty understanding about it. We do hand them out, and when we are going to be in close proximity to them, then we are asking them to wear them, and we do encourage them to also wear them on the system and when they're out in the public.
Okay.
Thank you all. All right, we have lots of questions, so I make sure we get time to get to all of them if possible. So we have one from Mayen. This is for Path. Are there limitations for your organization to scale up outreach and engagement on Metro besides the current contract amount? That might be a question for Joyce too, but we'll see.
Sure. I mean, there are always limits to where we can be. We have a wonderful set of teams that are working on the system now. We respond to both proactively and reactively to any issues that are identified either through law enforcement, through Metro Security, and through Joyce and her office. So our teams may on a given day be working at a particular hotspot that's been identified on the gold line or on the red line, and also general deployment in certain spots, typically identified again by Metro folks to let us know, where they would like us to be providing, the sort of more heated or intense services. But I think to answer the question, sure, there's room for in terms of the need. There's room for expansion, and I think Joyce might want to touch on the potential for that.
Right. Thank you, Stephen. Currently, we are looking to continue to expand our outreach, to engage other service partners to come alongside Path, to be able to also perform outreach. Right now, we have an MOU with two organizations that we're very proud of. One is called the Dream Center, and they deploy to 3 of our sites to offer assistance. And they have the Dream Center is a nonprofit faith-based organization, and we know that not everyone feels comfortable going to a faith-based organization for care, but there are some that would feel comfortable. So we're trying to diversify the outreach that we have to try to accommodate the unique requirements that a homeless population has. We also have a partnership with LA Door, and that's a partnership with a team of individuals that also visit several of our sites during the week and provide outreach. This particular agency is out of the LA City Attorney's Office, and so they offer something very different in terms of services, because they're able to say to someone, if you, instead of going before a judge again, if you agree to services, then you will be able to forego having to go before the judge. So we're developing partnerships. It's taking time, but please realize that the Homeless Action Plan was developed and actualized in 2017, and it was expanded in 2018. So we are still in the growing stages of learning best practices, learning from other transit agencies what they're doing. And so, but we are constantly looking to improve our outreach efforts.
Well, that's a great segue to another question that we received. How has policing tactics changed with the development of this homeless outreach program?
Policing tactics in terms of, I'd like to have a little more specificity in terms of what is meant by police tactics, because our law enforcement partners, the Los Angeles Police Department, the Los Angeles Sheriff's Department, the Long Beach Police Department, and our transit security, they operate with under a protocol that does not that limits any type of aggressive behavior towards anyone that's on the system. Our approach is to discuss, to try to get outreach services available, but we don't coerce individuals to accept services or to remove them from the system unless they are causing harm to self or to others. So our protocol, our contract has been approved by our board of directors in 2017, and so we are continue to move in a fashion of being accountable and also looking to continue to look at best practices across the nation.
And it may also be helpful for those listening to know just a little more about how PATH partners with law enforcement on the system.
Good idea.
We know that many people experiencing homelessness and others may have various experiences with those in uniform, and that their role is a little bit is obviously enforcement, where ours is engagement and services. So while we're in close communication and obviously keeping each other abreast in terms of the need for participation from law enforcement for PATH or PATH for law enforcement, we're generally not linked arm in arm with those to kind of create a sense of a safety and distance for those who may feel uncomfortable engaging with a team that appears to be directly connected to law enforcement. That's a long way of saying, we all have our job to do and we focus on that, and we help people understand that, our role as outreach and engagement is not to enforce, but to help and assist in getting them to safer space.
Thank you. All right, we're going to shift gears just a little bit from an anonymous question came in. How do you navigate conversations with community members and riders who do not share sympathy for the homeless? Unfortunately, some people would prefer to forcibly remove the homeless. How can we approach this conversation with compassion within our communities and at Metro?
Okay. I think it's a great question. Thank you for asking. That is the primary reason that Metro is involved with other community-based organizations, other social service agencies, and individuals, our own people within Metro, to educate individuals about the helplessness of those individuals that they may see that are experiencing homelessness. It's an educational process, and it takes time because many come with preconceived notions, as I think we've spoken about earlier today, preconceived notions about what it means to be homeless. Many people feel very upset at viewing a homeless person. So the dialogue needs to continue in a very open fashion with all individuals from whatever agencies at the table to discuss what are best ways, what are better ways to be able to engage with homeless individuals, so that we're not trying to negate them as human beings, because they're human beings, and we want to accord them the same respect that we would accord anyone else. And so that is Metro's stance. And so anything that we do that is out of Metro, through Metro, is going to be done with respect, because that is what we stand for.
And I think a big part of the work that we all do is about helping people frame things with compassion and to think through the challenges that people face. To better understand the situation. And thank you, Joyce, for reminding us again that folks are individuals and everybody has a story. Trauma affects the human brain in ways we're still discovering, and that make things appear to us to be so odd, or maybe people ask, how come they are doing this or they're choosing that, when the science is telling us that the brain doesn't make good choices when it's traumatized. So we try to bring that information along with the work we do, the compassionate work, to the streets, so that we can all all learn. And you know, we all live in the community as well. And we know that it's a challenge if there's someone, you know, impinging on our space or our freedom or however we view that, our you know, our environment. How do we can address that compassionately and address our own fears and concerns.
Right. All right.
Thank you all. Well, related, this might be more of a question for you, Joyce, from Henriette. Would it be possible to provide flyers or posters with information about where to find help at the stations and in the trains for the homeless? It would also educate the public that is not homeless.
Okay. Thank you so much, Henrietta, for the question. We are very, very concerned with continuing to educate the public. And so in terms of your idea, if you would contact me, and perhaps we can have a discussion about ways and means that you have in mind to see what might better work. We are always looking to provide more information, inform our ridership, as well as our employees and larger communities about, you know, what is going on, what resources are available, and how to be able to make connections, because it's all about collaborations. That is first and foremost, to be able to collaborate so that if you have an issue, we perhaps can direct you to someone that we know or an agency that we know that may be of assistance. Even though we may not be able to provide the information, we can certainly be a conduit to help facilitate that type of a conversation. So please feel free to reach out to me. You know, we have different departments within Metro that handle exactly what you are speaking about. So we would want to take your concerns and your suggestions to those appropriate departments to have discussion on it. So thank you for the question.
Thanks, Joyce. Yeah, and we will, when we close out Q&A in a few minutes, we will share the contact information again on the slide.
Okay, great.
Another question, lots of questions. Thank you all. Keep bringing them in. And this might have been touched upon before, but it doesn't hurt to clarify. There was a question. Are you planning on expanding PATH's jurisdiction from just the Red Line and Union Station to other routes and facilities to match the jurisdiction of some of the police agencies' mental evaluation teams, HOPE teams? So I don't know if you or any of you had explained the jurisdiction and the coverage yet, but worth clarifying.
Okay, yeah, absolutely. Stephen, would you like to address that?
Yeah, you could see I was like, well, we are system-wide. And again, I mentioned earlier, we are connected to law enforcement. So Karen can say more too about those daily connections that are made with the HOPE team and LAPD and the Sheriff's Department and so forth in terms of the details. And again, you know, room for expansion with the numbers that Joyce mentioned earlier, of course. But also keeping in mind that the team continues to have an effect in supporting people moving away. Since the beginning of our contracts 4 years ago, over 9,000 individuals have been offered assistance through the PATH work only. So and that coupled with the other organizations Joyce mentioned and the continued expansion to look at other ways to leverage support have really made an impact. So I'll pass it off to either Karen or if Joyce, you wanted to say something too about the more specifics about the connections with security law enforcement.
Yeah, thank you, Stephen. As Stephen was saying, there is a very close collaboration between our PATH teams and all of our law enforcement partners. We know, for instance, that there are hotspots on the system, and we know where those hotspots are. We know how to deploy to those hotspots. Many times we don't have sufficient personnel to be able to continue the presence, because when our teams are engaged with someone and they take them perhaps to get services, that leaves a void. That leaves a void at that particular location, because they are then assisting other people. But within our law enforcement teams, we have specialized units. Within LAPD, we have the HOPE team, they are trained. HOPE stands for Homeless Outreach and Protective Engagement. This is a trained group of individuals within LAPD that engage with homeless. Within the Sheriff's Department, they have the MET team. And MET stands for Mental Evaluation Team. They have specialized training, and they're able to engage with homeless, and they're able to connect them to services as well. And with our other partner, Long Beach Police Department, they have quality of life officers. And so all of these, the law enforcement agencies with their particular specialties of being able to engage with homeless, coupled with our PATH team and with our Dream Center and with LA Door, it's a concerted effort to be able to deploy where the need is greatest on a daily basis.
Christina, can I add one thing to that also?
Please.
I also want to inform people a little bit. There's generally a conception that outreach is about walking around and engaging with people, and that is the extent of the job. That's really the smallest part of what we do. So, you know, you meet someone, and from then on, you are trying to become an integral part of that person's life so that you can walk them through that journey into housing. So our staff are going to medical appointments with people. They're, you know, getting them into shelters and then visiting them there. They're taking them to services. So it's, you know, I think, you know, a lot of times when people talk about the coverage on the system and, you know, we want to see you out with every department and that kind of thing. I just want to make sure that people understand the extent of the work that the team is doing. They become really important people in these individuals' lives, and they spend a lot of time with them, and that's necessary in order to actually get them successfully into a permanent housing situation.
Thank you all. We have a few more minutes to answer some of these questions. Thank you again for everyone for putting in things on the Q&A. And just a reminder, if we don't get to your questions today, because there are a lot of great questions, you can reach out to us after the conversation. I entered Julia Brown's email in the chat for you all to see there, and she's been our wonderful moderator today, so you know who she is. All right, here is thank you for sharing that screen. Yeah, and you can visit PATH's website as well to learn more about their organization. Okay, there was one I was like, oh, so why do you think the system of services is so complex to navigate? And I can imagine any three of our panelists could answer that. Big question, right? But
great question. And I think I'd start by saying it's actually less complex than it used to be, which is a good thing, and why we have tools like la-hop.org, which is actually operated by the folks at the Los Angeles Homeless Services Authority at LAHSA. So several years ago, this obvious question was asked in the community because there were so many caring people and organizations that really wanted to make a difference and to help the obviously growing challenge of our neighbors experiencing homelessness. But people were understandably kind of using whatever resources and opportunities were available to them. And oftentimes services were duplicated and resources weren't efficiently used. So the coordinated entry system was designed to help funnel folks into support, to get them connected to outreach teams who would then kind of shepherd or navigate them through the process and the system. Of course, it remains complex, and it is a challenge in terms of the work, particularly in the wake of the pandemic. But we do see that there are effective ways for the teams who are doing the work to find the support and the services that people need. So for example, someone who may have been experiencing homelessness on the system for a long period of time and may have higher need of support for their mental health or physical health would be connected to a program with intensive case management service support, would also then be provided with housing voucher and ongoing case management so that the stability of their experience in that permanent housing would increase. The housing first model and other evidence-based practices have been put into play effectively across the community. They don't work for everybody, and we recognize one size doesn't fit all, but there is this capacity now within the system to discern the needs of people and to shepherd them into the programs that will be most effective in helping them, again, move into their own homes and be creative and wonderful members of our community, healthy and happy.
Thank you, Stephen.
Yeah, thank you. Well, we are coming close to 1 o'clock, and I just want to respect all of our panelists' time. So I think we have enough time for one more question, and it is from Wendy. How does the public join Metro in partnership? Are there public meetings, and what's the schedule? So I was actually going to drop in the chat a calendar of all Metro events. It's our online calendar of all of our virtual events going on right now. They're all virtual at this time due to the pandemic. And there's lots of opportunities to join meetings, everything from our board meetings, service council meetings, meetings about projects local to your area, and so many more. So I encourage everyone, I'm dropping the link right now, to check out our calendar. But I don't know, Joyce, if you have, or Julia, if you have anything more you'd like to add to that.
I don't. Thank you.
Okay.
Mhm.
No, I agree with what you're saying, Christina. Thanks for sharing that information. And I would also encourage anyone who's interested in following up on anything that was discussed today, please feel free to reach out to me directly. My email address is brownju@metro.net.
Yeah, thank you. So it is 1 o'clock. So I just want to thank all of our panelists and our moderator today and all of you for joining us for this very first Metro Conversations. Really appreciate the time you spent with us and your really thoughtful questions. I know we couldn't get to all of them, but please reach out to Julia if you'd like to follow up with the conversation. We do want to continue the dialogue with you. And if you didn't already, sign into the virtual guest book. The link was shared at the beginning today, so we can continue conversating with you. So thank you again, and hope you all have a safe and wonderful week.